Hi, welcome to MedBook. Today, let's discuss few more questions of DHA Pharmacist exam. Before starting, subscribe and follow the channel for future updates. The first question is: a 55-year-old patient is on treatment with heart failure, has complained about yellowish vision. Which of the following drug may cause this? Option A, digoxin. Option B, furosemide. Option C, valsartan, and Option D is hydralazine. Furosemide, valsartan, and hydralazine are not known to cause yellowish vision. The drug that may cause yellowish vision is digoxin. Digoxin is a medication commonly used to treat heart failure. It can cause several side effects, including visual disturbances such as yellowish or greenish vision. This side effect is known as xanthopsia and can be reversible upon discontinuation of the drug. Therefore, it is essential to monitor patients on digoxin therapy for any visual changes and adjust the medication dosage accordingly. So, the answer is Option D, digoxin. Next question is: a 46-year-old male presented to the hospital with severe cellulitis and a large abscess on his left leg. Cultures revealed MRSA. Which of the following would be the most appropriate treatment option for once-daily outpatient intravenous therapy? Option A, daptomycin. Option B, piperacillin and tazobactam. Option C, ertapenem, and Option D, fosfomycin. The most appropriate treatment option for once-daily outpatient intravenous therapy for a 46-year-old male with severe cellulitis and a large abscess on his left leg caused by MRSA would be daptomycin. Daptomycin is an antibiotic that is highly effective against MRSA infections and is often used in the treatment of skin and soft tissue infections. It is given intravenously once a day and has a low risk of causing resistance. So, the answer is Option A, daptomycin. Next question is: a 220-pound patient has been placed on a standard heparin drip of 15 units per kilogram per hour, intravenously. Heparin comes premixed 25,000 units in 500 milliliters. How many milliliters per hour will this patient receive? Options given are: A, 20 milliliters per hour. B, 30 milliliters per hour. C, 40 milliliters per hour, and D, 15 milliliters per hour. Check out how to solve this problem. So, the answer is Option D, 30 milliliters per hour. Therefore, the patient will receive 30 milliliters per hour of the heparin infusion. Fourth question is: an ICU patient with a history of diabetes is currently experiencing significant hyperglycemia. Her current labs reveal creatinine is 1.2, potassium is 3.5, and sodium is 134. Which lab would you most closely monitor with aggressive insulin therapy? Option A, sodium. Option B, potassium. Option C, creatinine, and Option D, BUN. Insulin therapy can cause potassium to shift from the extracellular space to the intracellular space, leading to hypokalemia. Hypokalemia can cause muscle weakness, cardiac arrhythmias, and other complications. Therefore, it is essential to monitor the patient's potassium levels closely and adjust potassium replacement therapy as needed. So, the answer is Option B, potassium. Fifth question: while taking the medication history of a 52-year-old female, she mentioned she takes an herb for her hot flushes. Which of the following herbal medicinal might she be taking for menopausal symptoms? Options given are: A, black cohosh. B, ginger. C, lavender, and D, turmeric. Black cohosh is a herb, commonly used to manage menopausal symptoms such as hot flashes, mood changes, and vaginal dryness. It is believed to have estrogen-like effects in the body, which can help alleviate menopausal symptoms. So, the answer is Option A, black cohosh. Next question is: a pharmacist receives a new prescription for Augmentin 500 mg. The prescription reads 1 tablet per oral bid for 10 days. A technician in the pharmacy fills and processes the prescription using 250 mg of Augmentin instead, since the pharmacy is out of stock of 500 mg Augmentin tablets. The pharmacist who is doing the final check of the prescription should: Option A, fill the prescription as it is. Option B, call the physician and get approval regarding this switch. Option C, not fill the prescription. Changing the medication dosage or strength without physician approval is not recommended, and can potentially cause harm to the patient. So, the answer is option C, not fill the prescription. 7th question is: which of the following vaccine is required to be stored in a freezer? Option A, hepatitis A. Option B, human papillomavirus. Option C, influenza, and Option D, herpes zoster. Herpes zoster vaccine is a live vaccine that contains weakened virus particles that are sensitive to heat. Therefore, it must be stored in a freezer at a temperature of -50 degrees Celsius to -15 degrees Celsius, until it is ready to be used. So, the answer is option D, herpes zoster. The following vaccines are required to be stored in the refrigerator. Next question is: home ovulation tests usually detect a preovulatory surge in which of the following in the urine? Option A, estrogen. Option B, oxytocin. Option C, progesterone, and Option D, luteinizing hormone. LH or luteinsic hormone is a hormone produced by the pituitary gland that triggers ovulation in females. LH levels typically surge about 24 to 36 hours before ovulation, which is the most fertile period of the menstrual cycle. Home ovulation tests detect this surge in LH levels in the urine, indicating that ovulation is likely to occur in the next day or so. So, the answer is option D, luteinizing hormone. Next question is: after completing the therapy, H. pylori follow-up status testing shall be done within what time frame to ensure H. pylori has been completely eradicated? Options given are: A, 7 days. B, 4 weeks. C, 6 months, and D, a month. The answer is option B, 4 weeks. 10th question is: an 80-year-old patient with asthma and low blood pressure requires anesthesia for an emergency surgical procedure. Which of the following agents would be most appropriate for inducing anesthesia in this patient? Option A, desflurane. Option B, ketamine. Option C, propofol, and Option D, thiopental. In this case, ketamine may be beneficial since it is a potent bronchodilator and may not lower blood pressure like other agents. So, the answer is option B, ketamine. If you have any doubts regarding the questions, please comment below. Subscribe the channel for future videos. And thank you for staying with MedBook.